Sepsis is the body's overwhelming response to infection. It can happen to anyone of any age, but more commonly it happens to the very old or the very young, or those that are immunocompromised. But like in my case, I was only 36 years old, so sepsis can actually happen to anyone. My experience with sepsis, my daughter was 10 months old. In the middle of the night, one night I was settling her in her cot and I banged my elbow on her cot. And hours later in the morning, I was in terrible pain and presented at Flinders ED. And 12 hours later, I was in septic shock and in ICU. I had emergency surgery that night and then spent about 10 days in hospital. I was then discharged, and perhaps the thing that stood out for me the most about my experience with sepsis was what I experienced post-sepsis, the cognitive issues, the lack of energy and that inability to get back to normal daily life. When I experienced sepsis, I'd never heard of it before. So my advice would be to know sepsis and know the signs. For me, it was rapid heart rate, high fever, my teeth were chattering. Sepsis can happen from any infection. So in my case, it was a bacterial infection, but it can be viral or fungal. If you've got any type of infection and it's getting worse, but not better, definitely reach out to your healthcare professional and ask, could this be sepsis? My experience at Flinders was overwhelmingly positive. The nurses and doctors at Flinders saved my life and I'll be forever grateful. There's names and faces that I'll never forget. Sepsis is serious. It can be a medical emergency. If you suspect sepsis, call out, speak to somebody, speak to a healthcare professional. It can happen to anyone. It happened to me.